Looks like we have a few people trickling in. Hello, everyone. All right. Let's see. Hi, Kwame.
Hi.
Sorry I wasn't letting you in.
Hi, Kwame.
Hi. Hi, Ricardo. Hey, Aubrey.
How are you?
Hello.
Doing all right. Doing all right.
Good. All right. Well, it looks like we have some attendees. We can just get started and then we can let a few more trickle in while we go over the agenda. But hello, everyone, and welcome to our Sierra Labs webinar, 2021 Trends, Digital Transformation in Healthcare. We're very excited to have you all here today. So let's get started. So for today's agenda, we'll walk through some introductions, then dive deep into how the pandemic has affected digital healthcare and what this digitization means for our healthcare industry moving forward. And then we'll have a quick Q&A session at the end. So please feel free throughout the duration of the webinar to submit questions into the Q&A session. If you like a question, you can upvote it, don't resubmit it. And then the ones with the most upvotes at the end, I will read. And any questions that we don't get to, I'll make sure that we respond in email or in a phone call after. So let's hop right in. So for today's keynote speakers, we have Kwame Ulmer, Aubrey Kelly, and Ricardo Barrios. Thank you all for being here.
Thanks for having us.
Yeah, I'm very excited. So Aubrey Kelly has over 15 years of professional pharma experience at Amgen under her belt and is now the CEO of Rabble Health, a digital health company that focuses on providing cancer patients with a personalized cancer patients with personalized patient engagement technology called MyRabble. Her son's diagnosis of acute myeloid leukemia in 2017, coupled with her passion to improve patient access, inspired her to create MyRabble technology to decrease the burden of cancer, starting with breast cancer. Thanks, Aubrey. Thanks for being here. Next, we have Kwame. Kwame Ulmer is a seasoned regulatory expert and the principal at Ulmer Ventures, a regulatory strategy consulting firm. He brings nearly 20 years of experience evaluating medical technology regulations, guidances, and policy in government, and serving in senior regulatory roles at medical device companies. He previously served as Vice President of Regulatory Affairs and Quality Assurance at Implant Direct, a Danaher Corporation operating company. And Kwame has served in progressive leadership roles at the US FDA and has personally evaluated over 1,000 FDA applications. Excited to have you here, Kwame, to touch on the regulatory aspect of what's happening in our healthcare system.
Thanks for having me. Thanks for having me, Alex.
And last but not least, we have Ricardo Barrios. He has an extensive background in the healthcare and digital space with over a decade of experience as an investor of various healthcare companies. He is currently a managing partner at Natural Bridges Ventures, as well as the CEO of a new digital therapeutics company called Adhera Health that is in San Francisco. Adhera Health's precision digital therapeutics platform focuses on bringing lifetime empowerment to people living with one or more chronic conditions. It uses personalized approach specific to each individual, personalizing their journey to help them achieve better personal outcomes. Thank you to all the speakers. I'm super excited to have you here and to dive into some of the discussions that we're going to have today.
Thanks, Alex.
Yeah, thank you. So I'm your host, Alex Castañeda. I'm the marketing manager at Sierra Labs. Here at Sierra Labs, we focus on automating regulatory compliance processes for healthcare and life science companies, allowing these companies to get their medical solutions to the market more efficiently. We believe that automation technology is the key to liberating innovation in the regulatory space. Thus, we offer an automated quality management system, Sierra QMS, and an automated cloud validation tool, Sierra Cloud, to ease regulatory burdens and lower the cost of regulations. And we are also proud partners with AWS and Atlassian Jira. So now that it looks like we have even more attendees, thank you all for showing up today. I think we can hop right into the speaker discussion. So for the first topic of discussion, we wanted to talk about, how COVID-19 has affected the healthcare industry and led to this digitization. But we wanted to start off with a quick polling question with the audience to just ask, how has COVID-19 affected your company, startup, and business plan? So the options are A, yes, or it's has COVID affected your company, startup, or business plan? A, yes, a lot. We pivoted our business model and or product due to COVID-19. B, yes, slightly. We shifted some internal operations due to COVID-19. Or C, no, not really. Our business wasn't affected much at all during this time. So it looks like we've got a few in already. We'll just give everyone a few more seconds to get some of these answered. Awesome. Okay. Ending in 3, 2, 1. All right. So can everyone see the results? Awesome. So it looks like the majority of you have selected B, but also a few of you have selected A, which makes sense. I mean, a lot of people's businesses have been affected during this time, which is what we're going to kind of dive into today. Yeah, so let's get started. This is a question for all the speakers. I mean, how prepared do you think this industry was to handle this kind of shift towards digital operations due to the pandemic? Anyone can start.
So I'll jump in. I would say
Sure.
there was moderate to little preparation to be able to, one, handle a pandemic that had, for the FDA's perspective, literally doubled the workload almost overnight. Not literally, but more figuratively and practically speaking, over the course of 4 to 6 months, the amount of applications for emergency use applications coupled with traditional applications stretched the resources of the FDA considerably, and this is acknowledged in some public statements by the organization. There is an ability to work remotely and handle digital applications, but just being prepared for a surge. I think on the government side, among many government institutions, the FDA could not have anticipated a once in 100-year pandemic, or wasn't quite prepared for it. That's my thoughts about it from the government side.
Yeah, definitely makes a lot of sense.
And
How about you?
I would maybe just add to that perspective. So when I think about the industry, I think about, certainly the government aspect, but then also providers, payers, patient advocacy organizations, digital health companies, et cetera. And so I think, it has impacted all of us, both professionally and personally in certain lights. I think on the digital health side, it's a bit of a boom time for digital health companies, because we saw a need kind of pre-pandemic, but that need kind of overnight, almost a year ago this Saturday, right, just completely increased. And so for those of from that perspective, I think that there's opportunity for further innovation, but it has required all of us to kind of get back down to basics in terms of what's the value that we're providing, what are the services, how do we start reaching, especially in healthcare, the patients who might not have access to digital kind of in basically any sort of kind of digital application for improved care. And so I think that it really kind of gets down to the individual business models and just models in general of creating care.
Yeah, I think that to add to what Aubrey just said, I think that there has been a full spectrum of impact depending on how prepared you were for something that you cannot really be prepared in advance.
Mm-hmm.
Some organizations, especially in the United States, have been digitalizing their services over the past few years. So what I've seen is that those have fared much better, which I think talks to the fact that digitalization actually has an impact in better healthcare outcomes. Ultimately, what you need to think about is that the patient is the one that was the most impacted, together with the healthcare providers, the physicians, clinicians. Mm-hmm. And those organizations that were able to support both their staff as well as their patient population through different means that they didn't have more use for before, are the ones that I think have done better. I mean, think about it, about 150% of the visits in the first few months, 150% increase in telehealth happened in the first few months of 2020 when the pandemic hit us a year ago. And then through the balance of 2020, about 40% of all those visits ended up being via some kind of telehealth or virtual communication. So I think that you need to look at that as an opportunity, as Aubrey is saying, but also it's a challenge to organizations because the normal pace in the healthcare industry is not the pace that the pandemic has put us on.
Yeah.
And that is something that a lot of people didn't see it coming, and their organizations were not prepared for that incredible shift. But we are in it, and it's one of those things. The avalanche is coming, so either you run and learn how to swim in the avalanche, or else. At least from my perspective, COVID has had that wider spread of impacts depending on where you were.
Yeah, no, definitely. I think it definitely depends on, what exact industry you're in and area you're in of how affected you are by this. Kwame, just kind of going a little bit more back into the regulatory side of things. How has this shift towards digital specifically affected the regulatory industry, regulatory bodies, standards and regulations?
Yeah. So, all regulatory agencies, generally speaking, throughout the world have twin mandates. Mm-hmm. Some put more emphasis on one as opposed to the other. One is to protect their population. The other is to promote the public health and innovation. And in an emergency, the tolerance for patient risk safety has to be adjusted and take into account the potential benefit for testing, vaccines, et cetera. And even phenomena that maybe aren't easily anticipated or thought about, the rise in anxiety in people seeking mental health treatment. So the FDA has consciously lowered the traditional bar for data needed to support devices that directly or indirectly help people during this public health crisis. So if you have a technology to facilitate matching a therapist to a patient for mental health treatment, you're not regulated, or the FDA is exercising enforcement discretion. Mm-hmm. If you're developing a PCR test, the amount of data to validate that test is significantly lower than would be needed for a traditional application, because the FDA does want to get the tools out to people to protect the population as best it can during this once in 100-year pandemic.
Got it. Yeah, no, that definitely makes sense. And then I guess shifting a little bit more towards, we have a variety of CEOs here in the audience today of healthcare companies. So Aubrey, you're kind of in the same boat as them. What kind of shifts have healthcare companies such as yourself had to make during this time? And is there anything that has become more digitized than originally was not intended to be digitalized pre-pandemic?
Yeah, it's a good question. So I will say that first of all, Rabble Health is a digital health company. So I think that, with a boom in need, that it's nice to at least have some sort of validation that we are solving a need. The other part is just the stage of the company that we are in, particularly last year, was incubation. So at that stage, there's just a ton of thinking and trying to get, our boots underneath us at the time. And so, some call it stealth mode. It wasn't necessarily by design, but I think that the pandemic itself for this particular stage of the company that we're in was somewhat beneficial, just because we had a lot of just work to do to kind of figure out our business model, anchor on building out the technology, et cetera. I think that business models have shifted. I know a number of different entrepreneurs who have chosen to go into COVID or try to look at API with the different telehealth companies. And Ricardo, I'm sure you'd be able to kind of give some perspective as well as a fellow CEO. But I think that, you know, if anything, as I mentioned before, just going back to basics. So how do we actually recognize that there's a massive need right now in terms of a different way of coordinating care, and how can we leverage appropriate technologies and partnerships to be able to get us there? The one part that I would just say is that, you know, yes, COVID is taking the spotlight, but the rate of, I think, strokes and cancer diagnoses have just plummeted. And those are not statistics that you want to plummet, because that basically means that you know, patients aren't getting the screening that they need. Maybe we're not being adherent to the, you know, just to the standard course of care that we would want to see. And so I do envision a bit of a healthcare kind of ripple effect of, you know, perhaps some of the more preventative measures that patients would be doing pre-pandemic, they haven't done this past year. And so I think that that's going to require us as an industry to really come together and be much more creative in terms of, hopefully post-pandemic, you know, how are we going to be responding?
Yeah, no, that's definitely correct. Yeah, and then kind of speaking towards Ricardo, who is also a CEO, but also, you know, knows a little bit or handles kind of the operation side of things. You know, what are areas of operations that were better prepared for something like this versus some that were not? I know you kind of touched on this earlier, but I kind of want to dive a little bit deeper into, you know, what you think the areas that may have had more trouble than others with this shift towards digital.
I mean, I think that the areas that have been most impacted, obviously, are the ones that are patient facing ones. And, you know, and that's why I was talking about preparedness earlier, that if you are shifting your patient population to the new digital tools, it's not about having the tools that are some tools in the market that are very helpful, is what is the learning curve for the staff also to be able to use those new tools. This is not something that can happen in 2 days. As I said before, the healthcare industry is not the fastest industry. You look at it, the adoption curve, you can look at Gartner's adoption curve, and you'll see where healthcare is in that curve. And I'm going to tell you, it's not on the top, okay? So there are some organizations, and I can give you a name, because I think it's organizations that I consider are models in the United States, like Geisinger. Geisinger, that is based in Pennsylvania and New Jersey, is one of those organizations that have been ready, been talking about digitalization for the past 10 years. So if you look at how quickly they shifted, they had to learn a lot on the go too. Don't get me wrong, but if you look at how quickly they were able to attend to the needs of the patient population, it talks to their readiness. So areas of operation, I am not a healthcare provider, an expert, and I'm not gonna be able to tell you exactly which areas in the hospital are the ones that have been the most impacted, but at a high level is what I said. I think that what it comes down to is what is important in this situation, and what is important is to be able to take care of those patients that have the most needs. In one of the things that I'm really concerned about is that because of the crisis, we have forgotten some of the key populations, and I'm going to talk to the senior population. If you think about the preparedness of some of these systems, that population is the one that has had traditionally the hardest time to access technology. That is changing, and I'll give you some, I think, bright lights later in this conversation. But a lot of the systems have had a hard time being able to take care of those most impacted population by COVID.
Yeah, definitely. And I know we touch on that a little bit later, you know, how to get this technology into these different diverse populations. But for now, we're going to shift a little bit more into, you know, talking about how the pandemic has affected data sharing. And I want to start off by asking the audience a poll about what they think. So this next question for the audience is, do you think people are more inclined to share personal data via health technology platforms and applications rather than in person or not via technology? A, yes, due to the level of convenience of technology versus that of traditional methods. B, no, people trust technology less with data safety than in person or more traditional methods. Or C, unsure. I see we got almost half. Give everyone a few more seconds. Awesome. Okay. About a few more. Okay, great. I'm gonna end it and share the results with everyone. Interesting. So it seems like the majority of you have chosen A, which, you know, is what we'd hope for since this industry is heading in the direction of digitization. It was heading in that direction regardless, but the pandemic has definitely sped this up. So we're going to just dive into, you know, the effects that the pandemic has had on on sharing, data sharing, and what this means for this digitization trend that's happening in our healthcare system. So let's start off with Kwame, asking a little bit more of the regulatory side of things. What kind of sacrifices do you think regulatory bodies have had to make in terms of data sharing during an unprecedented time like this?
So one interesting pivot is there for certain technologies, there's been an emphasis to share more information about the performance of devices that are critical during the pandemic. So specifically for COVID testing apparatus, the performance data is shared publicly in great detail, more detail than is typical for a traditional application. And the performance data is relative to certain gold standard test measures so that I'm not going to say a layperson could hop on the FDA website and easily interpret it, but someone with some training could understand, you know, how does the Abbott device compare to the gold standard, which is I think a good thing. In terms of personal privacy of one's data, there hasn't been a lessening of that. That is governed under HIPAA regulations, and every company, even the ones that are under enforcement discretion, are encouraged to implement HIPAA, enforcement discretion by the FDA. But I think some really interesting things have happened in the realm of sharing data for these critical diagnostic devices, so people get a sense for what's good and what's not so good. A wall of shame and a wall of blame at the same time, and fame. Yeah.
Yeah, I was waiting for you to say fame.
I know. It took me a minute.
Awesome. And then, you know, kind of touching on the more, you know, healthcare company side of things for Aubrey and Ricardo, have any issues or concerns surrounding the safety of patient data arisen during this time for either of you? Have there been any impacts on security or privacy while operating in this digital way? In essence, have you had to adapt your data strategy at all during COVID?
So I might answer that with just saying that perhaps we just have the luxury of being an early company and being able to tackle that straight on with kind of our mission of being able to provide solutions anchored on choice, clarity, and connection, right? And so I think it's really important, you know, even outside of health tech, that technology companies, you know, have been historically known on the forefront as not really considering personal data and personal privacy is kind of maybe a top focus. And so particularly in the healthcare realm, I think it's a really important, you know, yes, there's HIPAA compliance, but we should really be on the forefront of really ensuring, like, how do we ensure appropriate opt-in, having it, you know, having it transparency in terms of where that data are being used. How do we actually ensure appropriate, there are fewer barriers to actually opt out if a person chooses not to share their data, et cetera. And so we've taken that into design right from the beginning. But I do think that there's a lot of lessons to be learned, particularly from health tech companies, in terms of maybe, Kwame, to your point, the shame, blame versus fame of what to do and what not to do just outside of health tech, and taking an eye on tech companies.
Got it. Ricardo, did you?
Yes, I was muted. Yeah, I mean, I want to actually amplify what you just said, Aubrey, because we are also a startup, but we have, Hera Health has had almost 10 years of scientific background that has been put into the platform. And the interesting thing is that that scientific evidence has been built in a very stringent system, which is the European system. And as you know, Europe is the one that installed the GDPR regulations first. In that, GDPR is being transferred almost verbatim to the United States. So in addition to HIPAA compliance, we, by design or by nativity, have been a GDPR compliant company. So that's an issue that we take very seriously. And I think that everybody that is trying to accelerate the adoption of this type of technology should take into account. When I put on my investor's hat, I look at companies that are already undergoing quality management system type of activities. In the case of Hera Health, we are ISO 27100 and ISO 13485 compliant. And that's something that if you look at companies that are starting up, they are not paying attention as much as they should, because that is kind of like traditionally a nice to have. We are in a world where we are digitalizing and shifting the paradigm of health. And if you are not paying attention to the data integrity, you are going to be in trouble. But ultimately, the worst and the most impacted will be the patients, because they need this type of tools, and they want to be able to trust that the industry is doing things the way that they should be done. So this is, to me, not a company-specific goal. This is an industry-wide goal where all of us have to interoperate, and therefore we are going to have to be sharing information. And remember, the weakest link is always the one that breaks the ecosystem.
Exactly. And that is something that we hear a lot is this a need to have, or is this a nice to have? And what we're trying to convey is that these regulations and being, these ISO certification, ISO standards, they are a need to have. And they're getting more and more important as things become more and more digital.
And can I jump in with something, Alex? Uh-huh. I can't remember, because you prepared us thoroughly for this event, if we're going to cover international impacts, but Ricardo operates internationally. And one of the things I forgot to bring up is everyone, even the smallest of governments, with maybe some exceptions in sub-Saharan Africa, have adopted some regulations akin to the emergency use authorizations. Mm-hmm. So in Singapore, I had to do this research for a client. They have an EUA light set of requirements. So to your point, when you adhere to the more stringent requirements, GDPR, HIPAA, generally you're covered when you try and enter other markets. And Ricardo knows this because he operates internationally.
Yeah, no, it definitely benefits you to be following, some of these international standards, because like you said, when you go into a different market, and we see that a lot too with people, with clients that we have, when you go into a different market, a lot of these regulations overlap. So it really does benefit you to be making sure that you are hitting a lot of these regulations and standards. So yeah, and then Ricardo, you kind of touched on it for a second about your investing. So you have over a decade of experience in investing. So I kind of wanted to just ask you, have you seen any changes Or do you predict any changes in investor appetite as a result of this data privacy concerns, or this overall shift towards digital?
Well,
healthcare
I
system?
think that in the due diligence, investors are asking now about your data protection policy.
Mhm.
That was a question wasn't asked 5 years ago when you're talking about any kind of application, digital application in health, because it was more, these applications were working more in the realm of wellness. I want to be able to run 1 more mile every week. Nothing wrong with that, by the way. And it's actually there. It has been a great way to educate everybody that you have to take charge of your own health, right? But it was more like the investors were looking more about the ability of those applications to be used by a lot of people.
Mhm.
Now they are looking at, what is the depth, and especially now we're moving from wellness to therapeutics. And if you, so the point is, yes, they are looking carefully. We're looking carefully at that as a key determinant on whether this is going to be a long-term investment that is going to work or not. And as far as the climate, the perception is that this is not going away. So the virtualization of health is here to stay. And that is nobody. You talk to any investor that is investing today in health, they will not say, oh, this is going to go back to the 11% levels that we had in 2019 of usage of telehealth systems. That's not happening. So what does that mean? Well, data integrity is going to remain front and center.
Got it. Great. Yeah, so for this next section, I kind of wanted to dive a little bit deeper into the regulatory effects from COVID. So Kwame, this one would be for you, since you specialize in regulatory strategy and compliance. But first, I wanted to start off by asking the audience a quick question. So for this next question for them, I wanted to ask, do you think that fast-tracking COVID-related solutions during this time compromises regulatory compliance integrity? So yes, very much so. Yes, only slightly. Or no, it does not. This one's a kind of shorter question, so we'll give a little less time. All right, looks like we've racked up a few answers. I'll give everyone a few more seconds to get their answer in. All right, closing it off in 3, 2, and 1. All right, let me share this results with you all. Interesting. So the main answer was B, yes, only slightly, which makes sense. Yes, very much so, and no, it doesn't at all, are two extremes. But Kwame, let's kind of dive into why we think people do think that it affects regulatory compliance integrity. So, Kwame, how has the agency responded to roadblocks for clinical trials during this time? Clinical trials before COVID were very in person, and now people have to stay home. So what kind of accommodations have had to be done for this? And do you think that there's an impact on security and privacy from this alone?
So the FDA has released guidance that enables conduct of clinical trials outside of the traditional hospital setting.
Mm-hmm.
The practical implication, though, is hospitals have made their own decisions about how to implement that. So that's another area, and I don't claim to be a hospitalist or have domain expertise, but the FDA has lowered the bar in that regard. Your poll, in a way, was encouraging because the majority of people thought that there was no or slight impact on regulatory compliance. I will say the brutal reality is there have been certain compliance activities that have been put on halt simply because of the safety of inspectors, for example, FDA investigators to go into facilities, for example. And I talked about it before, the dramatic increase in workload and the officials at the FDA have already publicly stated that some of the typical timelines that they have committed to in the past, they will not be able to meet them because of an increased workload. But having said that, it's kind of nice that this sample of the public believes that there's been, in some ways it's good that they believe that there isn't an impact. But I would say from my observation, there's an undeniable impact because again, this is a once in 100-year event that I don't think it is easy to prepare for. And let me give one example before I shut up. The process to hire a reviewer is one that can take months. It's not the type of role that you just hire someone off the street. These people have typically years of experience, either in the government or outside the government with advanced degrees, and they're not just sitting on the street looking for a job. So just to hire up to get the expertise to do these types of scientific regulatory evaluations would take some time. And couple that with the doubling of the workload, there's going to be some strain. So I'll stop there. I'm done for now.
No need to, but thank you. Yeah, no, that makes complete sense. And then I guess I just wanted, I know we kind of touched on EUA earlier, emergency use authorization, but how common do you think emergency use authorization approach has become in this industry due to COVID?
It has become extremely common because people perceive it as a faster path to market. On paper it is, but in reality, because of the strain on the system at the FDA, it can, while it was intended to take weeks, it in practice, because of clarifications and back and forth, it can be a months-long process. So there's what was intended and then the reality based on the number of applications that people have flooded the FDA with.
Got it. Yeah, that definitely makes sense. And I guess this is a question that I have for the audience. Now that we have seen a lot more people using this emergency use authorization, going forward, would people be comfortable with fast tracking other solutions that are not COVID related, since we have seen how effective that it can be during this time, but there are also some dangers with getting too comfortable with fast tracking other solutions that aren't COVID related. So I just want to get the audience's opinion after you've given your 2 cents on, what this means for the regulatory industry. Let's see. These are coming in very quickly. So sorry, yes, the options are A, yes, very much so, B, yes, slightly, and C, no, I do not feel comfortable with fast tracking other solutions. Okay, I'll give everyone a few more seconds, but it looks like most of the votes are in. All right, 3, 2, 1. All right, ending poll, and I will share the results with everyone. So it looks almost split between A and B. So yes, very much so, and yes, only slightly, which is surprising. I actually thought the majority of you would say no, that you weren't comfortable with fast tracking other solutions. But I mean, there are definitely some pros and cons to fast tracking solutions. So it definitely makes sense why the answers have been kind of distributed across all three answers. So awesome. I just wanted to get all of your opinion on that. So next question, we're going to be, hopping into some of the effects on healthcare companies. So I know we have a lot of healthcare companies here today. Let's see. Whoop, there we go. So Aubrey, I wanted to kind of direct these questions towards you. Are you or have you changed your priorities in your product roadmap based on future outlook of where you think this industry is headed post-COVID?
Yeah, thank you. So no, if anything, we probably dug our heels in more. I think that one of the recognitions, I think one of the pieces that we're really trying to tackle is the I guess we're just trying to democratize information for patients for, throughout a cancer journey. And so, as I mentioned, recognizing that we're seeing statistics that we don't want to see in the context of number of screening rates, number of people who are being treated, missed appointments, et cetera. And that's going to have a long tail effect. And so it's, a firm believer of the fact that technology should be used to help address health disparities rather than cause further wedge. And so I think, if anything, recognizing this kind of new landscape has forced us to kind of double down and be very targeted in terms of, from a product perspective, we're launching in breast cancer, we're launching in Memphis. Yes, the app will be available for everyone, but in terms of outreach, we're committed to, I should probably provide the context that Memphis was listed as one of the top cities with the worst disparities in mortality rates across different races. And so in breast cancer patients. And so this is an opportunity for us to really kind of take a stand of maybe thinking different about technology and how we can position ourselves. So I feel pretty proud and strong about where we're going there.
Yeah, I
do think that it's kind of forced all companies to maybe help reevaluate a bit of how to pivot. I think, if I would be inappropriate to say it did have an impact on our marketing shift, but I think that's just an important consideration. So.
No, definitely. And I think a lot of these companies are in the same boat as you, trying to close some of the gaps in terms of, healthcare disparities. And that kind of leads directly into our next section, where we're talking about, healthcare's digitization effects on healthcare equity. And I wanted to just kind of start off with asking the audience their opinion on healthcare equity and what they think the current situation is in terms of healthcare equity. So how would you rate the current availability of healthcare across diverse socioeconomic populations? A, high. I think healthcare is available for all socioeconomic populations. B, medium. I think healthcare is available for most socioeconomic populations, but it could be more accessible for lower income areas. Or C, low. I think healthcare is not available for all socioeconomic populations, especially for those in lower income areas. So we got a lot of votes on that one pretty quickly.
This is interesting because we have some initial data coming in from cities around the world, cities around the country, where people are getting vaccinated in the socioeconomic, or let's just say, let me be more direct, the poverty level in a neighborhood. and race. So I think this is not even a guess, but it'd be interesting to see what the responses are.
Yeah, so let's close off the voting. It looks like most people have voted. Share some of these results. So it is along the lines of what I expected, mostly B and C. I think, there definitely are some health disparities that need to be addressed and are going to be addressed in today's conversation. And I kind of wanted to, shift this conversations toward Ricardo, because I know this is an important issue for you, and your app aims to, challenge some of these healthcare disparities. So kind of want to just start off by asking you, do you think that this trend towards digitization in healthcare as a result of the pandemic will also enable new health technologies to be used in a broader community? And can these digitization trends lead to increased healthcare equity?
The answer is TBD, because I'm just going to give you some data. The cost of inequality in the health inequities, in the United States, some studies is $1.24 trillion. This is a study from the American Public Health Association, and those numbers are there for a reason. It's a combination of racial disparities, and is what Kwame was alluding to. And it has also to do with the fact that certain populations that are in the lower segment of income don't have the I'm not going to say the knowledge, they don't have the possibility of having a healthier lifestyle. So people talk, I mean, I don't want to mention any TV programs, but you hear programs talking about education and why is that people don't eat better. You know what? I live in California, I live in the Bay Area. I can go to Safeway or I can go to the local, health food store, and the difference in price between one and the other is 3x. That's between Safeway. Now I'm talking about Safeway is the corner store. If I go to the corner store, then the difference is much more, and that's the beginning. So I think that you need to look at the infrastructure of society, and when these populations cannot access good food or healthy food, it's like snowball down the hill and ends up adding then chronic diseases, and then adding all these other things that end up in a $1.24 trillion cost to society. And I mentioned the cost, not because the cost is more important than the people, is that when I mention the cost, some people pay attention because the healthcare organizations, they also are ultimately going to have to pay for that cost, right? So that's my perspective today. What I think is that digitalization of the paradigm will help elevate these populations and will help lower the cost of health or the cost of providing health. Therefore, there should be a transmission onto these populations. But I also want to warn you that the same way that certain sectors in society have a hard access to better healthcare and better food and better nutrition, they also have a harder access to these new technologies. Right now, we're having a conversation over Zoom that requires high bandwidth. How many people in the United States can afford high bandwidth? I don't have this exact data, but I can tell you that at $100 a month per household, not every household in the United States can afford $100 a month to pay for the internet. So I think that we have a lot of work to be done. And what it comes down to is that the ecosystem, and I mentioned this before about the educational part, I think that the ecosystem has to work at unison. So, one of the things that I believe are going to help is the interoperability among different systems that will lower, again, the cost to access to good health and healthcare. And it's going to be a combination of all these interactions that will enable the people that have less access to the new tools to be able to access these tools. There's a lot of people that are doing great work in large companies and in nonprofit organizations, but it has to go beyond that. And what I mean by that is, at Health, we are looking at the Hispanic population because of our tradition, European tradition, and the fact that we see that we have to provide these tools at a cost that can be afforded by the organizations that will be subsidizing the tools for these lower income populations.
Exactly. And as you mentioned, some of the main challenges with with this technological boom is how are we going to get these new technologies into some of these lower income areas or these less technology forward areas. And as you mentioned, a way to help that is, bringing price points down of these healthcare products to a price point where these communities can meet and where they can afford. And that's what we focus on here at Sierra Labs. We focus on helping these healthcare and life science companies take some of the costs off of regulatory compliance and automating a lot of their processes, lowering their manual overhead so that when they do get to market, they can, lower these prices of their products so it can reach these markets that, need it to be at a lower price point. We want it to be able to produce a product that will be profitable for the company, but also can access a wider range of communities. So that is our main goal at Sierra Labs, and that's what we do. So this kind of discussion kind of shifts into, our next topic, which is about, what are some of the tools that people are using to help with this digital healthcare trend, to help bring down the cost of, their product development and, their manufacturing. So I, again, want to start off with just a poll for the audience, just to get a sense of, what tools are people using out there to help them manage the pandemic. So this next question is about the tools you use, audience members, and you can select multiple, select all that apply, but select the tools that have helped you manage operations throughout the pandemic. So there's a QMS, there's project management tools, CRM, ERP, none, or other. And again, please feel free to select, any of them that you're currently using. All right, looks like we have about half of you. Give you a few more seconds. Oh, and also during this time, I just wanted to point out that there's actually I see some questions being asked in the chat, which is completely fine. I'll read them from there as well. But you can also put in your questions there's a Q&A section, I believe next to the raise hand section. And in that section, when you ask questions there, that's the one where you can upvote people's questions. But I see some people saying upvote in the no problem, Brandon. You can totally do it in that one as well. I see both, but I'm just saying it might help you out with getting those upvotes and getting your question answered. And we are running a little bit short on time, so let's make this next section a little bit concise so we can get to these questions. And whatever questions don't get answered, I'll make sure that they get answered, whether it's via email, via phone call, if you want to set up. I will definitely get all these questions answered. So thank you for submitting them. So it looks like the majority of you all are using project management tools, which makes a lot of sense. I'm actually surprised by the amount of you that have a QMS. So that's awesome. I'd love to know more if it is, a manual QMS, if it's kind of a, working with Google Docs, but then also with some Jira and trying to tie it all together, or if it's, a highly automated, concise system. So maybe I can reach out to you guys after and I'm really curious into seeing what you use, but that makes a lot of sense that the majority of you are using tools during this time, because you do kind of need these tools to help manage all these regulations, especially during a hectic time like this of a pandemic. So yeah, that kind of leads me into my next question. Just Ricardo, what are some tools that you think can bring down the operational costs for healthcare companies, since in the last section you were talking about, healthcare equity and health disparities? What kind of tools do you think could help bring down, these costs and get these solutions into lower income communities?
Well, first and foremost, Sierra Labs for sure would be.
I love it.
Okay, and I know that sounds something cheap, but it is the truth. I mentioned it earlier. If you want to get money from investors in this new space, you have to start thinking like pharmaceutical companies think. And I know that is a scary thought, because pharmaceutical companies have a huge bar that they need to pass. But we are talking about a revolution where we're going to bring these platforms to people to help them with their health, and that requires quality. So I think that would be one of them. But I also wanted to mention something that I think is important, and is interoperability. I think that right now the good news is that EMR companies have realized that, I remember back I was at a HIMSS in 2000, I think it was 2014 or 15, and they were talking about the new Secretary of Health was talking about we're going to enforce interoperability among all the EMRs. So that never happened, by the way, right? But in the past 3 years, EMRs are realizing that they need to open up. And that actually is related also to the question earlier about data and data privacy. They realize that they need to open up. Otherwise, the platform or the network effect of having information of patients in different systems and different locations in the United States. I'm talking the United States, not the NHS in the UK, which is different. That power is not taken advantage of. So I believe the interoperability and the openness of those EMR systems and integrating with platforms like Adhera Health or applications like Rabble Health, that's going to be a necessity if you want to take advantage of. So that I wanted to make that point. And the second point I wanted to make is that the digital therapeutics platforms are here to stay. And we are going to have to understand how to take advantage of that in the near future. But it's not clear yet. So there's a lot of noise in the market, and our job, and I think that Aubrey probably would agree, the largest challenge that we have is to be able to explain how we're going to work ourselves into this complex and very silo-oriented system.
Yeah.
Got it. Yeah, Kwame, I just kind of wanted to jump to you since we're running a little short on time. Are there any regulatory tools that your clients have been using during this time due to this digitization shift?
They generally want to try and make their QMS, their installation or quality management system more efficient. And if there are templates or tools to standardize the application process, those are two things that jump out as near-term needs that I'm seeing among companies entering the U.S. market.
Got it. Okay, and then for our last topic, to kind of just jump in to the whole theme of this webinar, which is 2021 trends, and then I will quickly cover. I think we have 2 questions, so it won't take too long. Quickly answer those questions, but just quickly, what are the new emerging trends that are happening in 2021 due to this digital shift? And this is for all of you, or any of you.
Maybe I can kind of go on the coattails of Ricardo, what you were saying, but I think there's a few things. One is certainly a digital kind of revolution, having the backbone of appropriate compliance and infrastructure, certainly. But I think that there's a recognition that across the entire ecosystem, if we want to be able to help current patients feel empowered, meaning that they have greater control over the decisions and actions impacting their care, and help future patients, and given platforms or partnerships in which we enable patients to be able to learn from those before them and give hope to patients after them, we can't do it without appropriate partnerships. It's not a one size fits all and one company is going to kind of have the golden ticket. It's going to be done in a way that, and I'm a sports junkie, so it's like we got to start rowing as a crew team rather than a swim team, right? And so I think that what the trend that I'm really hoping for is that we're going to see the appropriate partnerships, working groups, et cetera, so that we can start really focusing on the patient and improving outcomes from that perspective. So that's what I hope to see.
Definitely. Ricardo or Kwame, do you have anything to add to that?
Kwame, you want to go first?
Yeah, just a real classic pattern I'm starting to see emerge is a company develops an MVP that is lower regulated, maybe under enforcement discretion to get in the market, get exposure, grow the set of data. Then they develop analytics, claims, features that make it more highly regulated, maybe get a de novo, breakthrough designation, et cetera, and build a more defensive moat. And that 2-step process is, I think you're going to see that persist over the coming years. Last thing I'll say quickly, along that journey, partnerships with pharma, even CROs, to channel partners to accelerate sales, to really deeply penetrate their target markets. That's a classic playbook that I think even non-traditional entrants into the medtech industry will find fruitful.
So I want to, let me take a third different prism on this question, because I think technology-wise, there's a lot of good stuff happening with artificial intelligence that you're going to see impacting the future of healthcare. Adhera Health is fundamentally an AI-driven platform, and we did that by design, because we believe that you're going to need to have more tools that learn from all this data that is being accumulated, but in a way that is meaningful to the most important stakeholder in this conversation, and that's us, because we all are patients. We all are members of the society. But I wanted to take my take was more from the prism of those populations that are at a more disadvantage and many times not thought about. And we talk about health equity, but I want to talk also about the aging of the population. We as a population, we are aging, and there's some data that is staggering. Like in the United States, you see that in 2017, the average age is 79.7 years, but in 2060, that's going to grow 6+ years. That's going to go to 85 years and a half. What that means is that this population that we kind of like many times forget about, and by the way, during the COVID, they were the most impacted, and they were the most forgotten, because that cuts across all races, is a very important population. And when you think, and they say, well, the senior population doesn't understand technology, that is another fallacy. That is not true. And I have another data that says that in the older population is migrating to digital tools and using digital tools and wearables. I mean, something like, let me see, the data I have here is 76% of, this is a poll that was done 2 weeks ago. 70% of people over 65 years old said that the most important aspect in their lives is to maintain an independence. And that population said that in that poll that they consider wearables and digital tools as a vehicle to achieve that independence. So the lesson for me, at least, is let's have a holistic view of our of population. And when we are talking about health initiatives in digitalization of healthcare, let's bring everybody into the fold, because I do believe that we have some misperceptions, and in the data doesn't support those misperceptions.
Great, thank you so much. It looks like we are out of time. I'm running a little bit over. Thanks to everyone that's still here. We appreciate it. I know people might have some conflicts after, but there was just one quick question that I wanted to read from someone in the audience that asked Kwame specifically about, regulatory. They said, if COVID ended today, has the FDA learned anything from COVID about their original regulatory methods? And will they change anything? Will they go back to old methods? And Kwame answered, so I'll just let you answer quickly, Kwame.
Yeah, thank you. And thanks for hipping me to this new way to answer questions. So some guidances will be phased out. Some will be updated with probably less regulatory burden than traditional applications. But I think what permanently has changed is the FDA at least clearly knows they can iterate on guidances at a much higher cadence if they choose to. And that may be quite helpful, particularly for digital health guidances. And there's a whole Center for Excellence in Digital Health. So maybe they'll iterate a bit quicker as they promulgate guidance. But thanks.
Great. And I think that might be it for questions. But since everyone's still here, if anyone did want to ask a question out loud to one of us, you can click the raise hand button and I can allow you to speak. If you did have any, personalized questions that you wanted to ask that may be hard to type. If not, I will be sending a follow-up email to everyone where you can ask any more questions that you have, and you can schedule a call with, I'm sure, any of us, and we would love to get those answered for you. But that is the end of our webinar today. Thank you so much, everyone. Thank you to all the keynote speakers, and thank you to everyone who joined. I will be sending a link to this webinar following probably either later today or tomorrow. So be on the lookout for that. And yeah, thank you all for your time today. Such
Thank
a
you,
great
Alex.
time.
Thanks.
Thank you.
See you,
Thanks,
Thanks.
Alex.
Juan.
All right.
Have a great day.
Bye. Bye, everyone. Have
Bye.
a great rest of your day.
Bye.
Thank
Bye.
you.
Thank
Bye.
you. Bye.